In the intricate dance of human physiology, where every organ and system plays a role in maintaining balance, blood pressure stands as one of the most critical indicators of health. It is the silent force that moves life through the arteries, delivering oxygen and nutrients to every cell in the body. When this force becomes too strong, when blood pressure rises beyond healthy levels, it can set off a cascade of complications, from heart disease to stroke. For millions around the world, managing high blood pressure is not just a matter of health, but a daily necessity. And yet, even as modern medicine has made incredible strides in treating hypertension, there is a growing awareness of a less discussed side effect: the unintended depletion of essential nutrients in the body. Blood pressure medications, while life-saving, are not without their complexities. They work by altering the way the body regulates fluids, muscles, and hormones, but in doing so, they may also rob the body of vital elements it needs to function at its best. This revelation has sparked a new wave of interest among both medical professionals and patients alike. As people become more informed about the long-term effects of medication, the conversation has shifted from merely controlling blood pressure to understanding how these treatments affect overall wellness. The story of blood pressure management is no longer just about lowering numbers on a monitor, it's about sustaining a delicate equilibrium within the body. At the heart of this discussion lies the issue of nutrient loss. Blood pressure medications, particularly diuretics, beta blockers, and corticosteroids, have been found to influence the absorption, metabolism, and excretion of key nutrients such as potassium, magnesium, calcium, vitamin B12, zinc, and even sodium. These minerals and vitamins are not just passive players in the body, they are the building blocks of energy, muscle function, bone strength, and neurological health. Consider potassium, for instance. This mineral is crucial for regulating fluid balance, nerve signals, and muscle contractions, including the rhythmic beating of the heart. When diuretics are used to manage high blood pressure, they increase urine production, which helps reduce fluid volume and ease pressure on the arteries. But in doing so, they also flush out potassium at an alarming rate. Low potassium levels, or hypokalemia, can lead to symptoms like muscle weakness, cramps, irregular heartbeat, and chronic fatigue. The irony is that while these medications are meant to protect the heart, they may inadvertently place it at risk if left unchecked. Similarly, magnesium, a mineral involved in over 300 enzymatic reactions in the body, is essential for muscle relaxation, nerve function, and bone health. Diuretics can strip the body of magnesium through increased urinary excretion, potentially leading to muscle cramps, anxiety, and weakened bones. Magnesium also plays a role in regulating blood pressure itself, creating a complex feedback loop between medication use and nutrient status. Calcium, often associated with strong bones and teeth, is another nutrient affected by certain blood pressure treatments. Corticosteroids, which may be prescribed alongside other antihypertensive drugs, can interfere with calcium absorption and disrupt the function of bone cells. Over time, this can contribute to the development of osteoporosis and an increased risk of fractures. The message here is clear: while calcium is necessary for structural integrity, its availability can be compromised by the very drugs designed to keep the body safe. Vitamin B12, a water-soluble vitamin essential for red blood cell formation, nerve function, and DNA synthesis, is another casualty in the battle against high blood pressure. Some medications, along with related drugs used for conditions like diabetes, can hinder the absorption of B12 in the gastrointestinal tract. A deficiency in this vitamin can manifest as fatigue, neurological issues, and even anemia. Given the importance of B12 in maintaining cognitive and physical well-being, its depletion is a concern that cannot be ignored. Zinc, a trace element with far-reaching roles in immune function, skin health, and wound healing, is also vulnerable to the effects of long-term medication use. Certain drugs that reduce stomach acid, often taken in conjunction with blood pressure medicines, can impair the body's ability to absorb zinc effectively. A deficiency in zinc can weaken the immune system, slow down recovery from illness, and affect sensory functions like taste and smell. Even sodium, typically seen as the villain in the story of high blood pressure, is not entirely benign when it comes to medication interactions. Diuretics increase sodium excretion, helping to lower blood pressure by reducing fluid retention. However, excessive loss of sodium can lead to imbalances that affect energy levels and muscle function. This highlights the fine line between beneficial and harmful effects in the context of drug therapy. The consequences of these nutrient depletions are not limited to isolated symptoms. Over time, they can contribute to a broader decline in health. Muscle cramps and weakness may limit physical activity, while fatigue and irregular heartbeat can impact quality of life. Bone pain and poor immune response may signal underlying deficiencies that, if left unaddressed, can lead to more serious complications such as osteoporosis, anemia, and nerve damage. These findings have prompted a shift in how healthcare providers approach the treatment of hypertension. No longer is it enough to simply prescribe a medication and monitor blood pressure readings. There is now a growing emphasis on holistic care, on considering how each treatment affects the body as a whole. Regular checkups, once routine, are becoming more detailed and personalized. Doctors are increasingly looking at blood tests that measure nutrient levels, ensuring that patients do not fall into the trap of being medicated but undernourished. Dietary interventions have also taken center stage in this evolving narrative. Foods rich in potassium, such as bananas, oranges, spinach, and sweet potatoes, are being encouraged to counteract the potassium loss caused by diuretics. Magnesium-rich foods like nuts, seeds, whole grains, and leafy greens are being recommended to support muscle and nerve health. Calcium sources, including dairy products and fortified plant-based alternatives, are being emphasized for bone protection. And for those who struggle with B12 absorption, dietary changes or supplements may be necessary to maintain adequate levels. Supplements, too, are playing a more prominent role in the management of hypertension. While they should never replace a balanced diet, they can serve as a bridge when nutritional intake is insufficient. Potassium, magnesium, calcium, B12, and zinc supplements are being considered more frequently, especially in cases where deficiencies are detected early. However, the use of supplements must always be guided by professional advice, as excessive intake can lead to toxicity and interact negatively with existing medications. Beyond nutrition, lifestyle modifications are gaining recognition as powerful tools in the fight against high blood pressure. Regular exercise, for example, has been shown to improve cardiovascular health, enhance nutrient uptake, and even help regulate blood pressure naturally. Stress management techniques such as meditation, deep breathing, and mindfulness are being explored for their potential to reduce stress-related spikes in blood pressure and promote overall well-being. Limiting alcohol and caffeine consumption, quitting smoking, and maintaining a healthy weight are all part of a comprehensive strategy to support long-term health. What makes this topic particularly compelling is the realization that managing high blood pressure is not just about taking pills, it's about making choices that align with the body's natural rhythms and needs. It's about understanding that every action, whether it's eating a potassium-rich meal or engaging in a morning walk, contributes to the larger picture of wellness. It's about recognizing that the same body that benefits from medication also requires nourishment, rest, and care. As research continues to uncover the intricate relationships between blood pressure medications and nutrient metabolism, the medical community is adapting. New studies are exploring alternative formulations of medications that minimize nutrient loss, while others are investigating the long-term effects of supplementation in patients on chronic treatment regimens. The goal is not only to control blood pressure but to preserve the body's integrity and vitality. For individuals navigating the challenges of hypertension, this knowledge offers both empowerment and responsibility. It invites them to take an active role in their health, to ask questions about their treatment plans, and to seek out solutions that go beyond symptom management. It encourages them to view their bodies not as separate systems but as interconnected networks, where the balance of one can influence the stability of many. In the end, the story of blood pressure management is one of complexity and nuance. It is a reminder that while science has given us the tools to combat chronic conditions, true healing often lies in the harmony between medication and nature. By paying attention to the subtle ways in which our bodies respond to treatment, we open the door to a more complete and sustainable approach to health, one that honors both the power of modern medicine and the wisdom of the body's own design. And so, as we bring this journey to a close, one thing becomes abundantly clear: managing high blood pressure is not just about the numbers on a monitor or the pills in a bottle. It's about understanding how those treatments interact with your body, how they support, but also how they may silently take away. The conversation around hypertension has evolved from simply lowering blood pressure to nurturing overall wellness. It's no longer enough to treat symptoms alone. It's time to look deeper into the long-term effects of medication and how they shape our health over time. Every drop of potassium lost, every trace of magnesium excreted, and every vitamin B12 left unabsorbed tells a story that matters for your energy, your bones, your nerves, and your heart. What you choose to eat, what supplements you consider, and how you move your body all play a role in balancing out what your medications might be taking away. This is where empowerment begins. You are not just a patient, you are an active participant in your own health. Ask questions. Stay informed. And don't hesitate to have open, honest conversations with your healthcare provider about the full picture of your treatment plan. Because at the end of the day, the goal isn't just to live longer, it's to live better. To feel strong, energized, and in control. To wake up without cramps, to walk without pain, and to breathe without fear. That's the kind of health we should all be striving for. If you found this video informative and eye-opening, don't forget to hit that like button, subscribe, and ring the bell so you never miss another deep dive into the science behind your well-being. Share this with someone who might need it, because knowledge is the best medicine. Thank you for watching.